I think that's going to backfire very strongly. We have this, you just alluded to it, lower is better mantra, like really focusing on getting LDL cholesterol and ApoB lower and lower and lower. And I think it is a reaction to alternative points of view on the pathogenesis of heart disease, risk factors that are important, whether or not people need to be treated. And I don't think any self-respecting individual could stand behind the statement lower is better as an umbrella statement. Better with respect to what? Cardiovascular outcomes. How are you lowering it? Because that's important. But my impression is conventionalists might want to push a conservative narrative because they don't want people, seeing an inch and taking a mile. But what I think is happening is people, even if they don't understand the depths of metabolism and cardiovascular health and atherosclerosis pathophysiology, most people can tell when they're being patronized too. And when you project a message of lower is better, that's all you need to know, here's a medication, people get pissed off and they react. And what's more, I think a lot of conventional outlets, including cardiovascular journals, are destroying their credibility and the credibility of the associated medical establishment by putting out what are effectively propaganda pieces that can be very easily explained. So I can give specific examples. But for example, did you see what was it in JAMA Cardiology, that there was that cardiovascular imaging report of the man with the yellow nodules on carnivore?
No, I didn't see that. That's interesting.
I'll send it to you. So it's a brief report, and they present a case of a man in his 40s. That is the entirety of the patient's description. They don't give his actual age. They don't give any genetic, family, or other history. And then they say he had been on a carnivore diet for 8 months, eating, get this, 9 pounds of meat, cheese, and butter per day. Per day. And the first author went on mainstream media news and doubled down on that narrative, that was the dietary intake. And then they said he had basically cholesterol oozing out of his skin, and they showed something.
Xanthomas or whatever, right?
Yeah. And it was just, it read like a Monty Python skit. It was behind a paywall, so people just kind of assumed maybe there was more details. I looked at it. I posted literally the whole thing on social media. I emailed the journal. I emailed the first author. I even said to the first author, if you actually have data on this patient and want to do a more comprehensive report, I will help you write it. I will do the legwork. And if you want to get genetic testing, I will pay for it at my expense. No response.
I think there are two other aspects to add in terms of the reaction, which we have to acknowledge as head up, just to understand the psychology, but also the barriers to the truth. One is most cardiologists, most doctors have no training or understanding of lifestyle interventions to prevent and manage heart disease. Okay? Zero. So, you give a man a hammer and every problem is a nail, right? So for them, their only approach to see a high LDL, which again, they don't fully understand the data on, is because they're just following guidelines and a narrative that's being pushed through propaganda, right? Is that they think they've got this drug and you take this drug. The second issue is, and this is a second barrier to them maybe speaking out, even the ones that do realize there may be an issue, they would be very reluctant to go against what their peers and what the guidelines are telling them, because they know that that is going to be potentially threatening to their career. And I say this as someone as an example of being in this space for, almost 15 years. As soon as I wrote in the BMJ in 2013 that saturated fat doesn't cause heart disease, we've overestimated, I didn't say completely, overestimated cholesterol as a risk factor. We've over-medicated people on statins, right? We should be pushing low-carb diets, right? Hit all those in one 800, commentary piece that got peer-reviewed and press released, became a big news story. I've had relentless threats to my career ever since then. I've lost 3 jobs. I carried on with the campaigning, but that was what happens. So you've got people, one, that don't understand it. 2, if they do understand it, are they going to speak out? But listen, the truth is the truth. And incrementally over time, this ripple effect, and the more and more of this sort of research that gets out there, and the more advocates we have, Nick, powerful advocates like yourself, like Dave Feldman, right? Like others like Malcolm Kendrick in this space and Ofe Rabskov, the more people that speak out and articulate this with the scientific evidence, as you say, the harder it's going to be for them to maintain this false paradigm.